Thank you.
Good evening and welcome to this conversation. I'm Faye. Thank you for joining us. We are in the middle of a public health catastrophe. There is no other way to describe what is happening in the country right now. What we've done is invited the two most proficient public health experts that we know of in the country, and they've been kind enough to give us their time. We want to talk about various things. India's vaccination plan, the crisis that we're facing in public health right now, and what the possible solutions could be, and what the way forward is for India. Joining me at this point is Dr. Professor K. Srinath Reddy, who's the president of the Public Health Foundation of India. You should really, if you're hearing him for the first time, one, Google him. Secondly, listen to his TED talk about why he quit his, his career as a private, health expert. He was heading a team at AIIMS and decided to focus on public health. It's really important. Also, we have Ms. Poonam Muttreja, who's the executive director of the Population Foundation of India, has spent decades working in public health. So we're very happy to have both of them join us this evening. Thank you both for your time. I appreciate it. My first question to you is simply going to be this. So just to help us understand, Dr. Reddy, how did we arrive at this oxygen crisis in our country? And what do you think the solutions are at this point? We understand that the government is now moving oxygen by train. Is that the solution? How do we reach a point where our hospitals don't have oxygen? They're going to court, they're tweeting about it. The situation seems really desperate.
It is desperate, and that's because we have not invested sufficiently in producing oxygen for medical usage. We have been using oxygen for industrial use, and substantially so, whether in steel industry or elsewhere. But in terms of hospital usage, we had reasonable amount to go by in a non-emergency situation. But we did not prepare for this level of an emergency. Even last year, there were some difficulties experienced, but it was never of this magnitude. And once it was felt that the pandemic had passed, and erroneously so, in January, the oxygen supplies which were previously prioritized for healthcare were now back to industrial use in full scale. There was that sense of urgency in the industry, shared also by the government circles across the country, that they wanted to get the economy running again at full speed. Therefore, when actually the crunch came, they had to actually take a decision to stop the steel plants and other areas where the oxygen was being utilized in large amounts, and then bring it back to medical use. And that took time. But the second thing is we have not invested sufficiently also in the production of oxygen. If you look at the state of Kerala, they are producing at least 4 times that is required by the state itself, maybe 3 to 4 times. And now they're sharing it liberally with other southern states and Goa. So if we had actually invested earlier in this kind of thing, that we would have adequate oxygen for medical as well as industrial use, and some spare capacity as required, then that would have been very helpful. And now we are actually trying to import oxygen generating plants from Germany, trying to airlift them for the army hospitals. But what about the rest of the hospitals? So these are going to be some challenging questions ahead. The plain fact is we did not anticipate and prepare for it.
Doctor, you did say, of course, in the first wave of COVID, there was nothing, we needed oxygen, but it was nothing like what we're looking at right now. So I do want to know, how is this wave different from the previous wave? And also from a public health planning point of view, could it be argued that this was completely unforeseen and no one could ever have prepared for something like this? Or is this a situation ideally that all countries should prepare for?
Well, the first wave took a much longer time at a slower pace and also slower scale. If you looked at what happened at the beginning of the lockdown, we really did not have a major rise in cases at that time. And then subsequently, during the lockdown, of course, the pace of rise of cases was slow. Even later on, we unlocked in stages and never completely having an unrestricted movement across the country, or everything was not open. Even some of the travel restrictions were there. Some of the restrictions on large-scale malls and things like that were there. But this time it was a big surge of a magnitude that was not really anticipated, and at a speed that was not anticipated. So we have seen the system getting overwhelmed by it. And that is exactly why we have actually run into this kind of a problem this time. It's not as though we should not have anticipated that this would happen. Unfortunately, the feeling that we have acquired herd immunity led to a premature declaration of victory, which was erroneous. Many of us felt that it was incorrect and we should anticipate a possible resurgence, though we also probably did not expect this sudden and severe surge. But nevertheless, the fact that second waves have happened in other countries, the fact that herd immunity was an illusory concept, particularly at the level that we had earlier of antibody surveys revealing only 21% of Indians affected by January, we should have recognized that we were in for trouble if we continue to take the pandemic for granted.
I'm going to ask you a point blank question. You did say in your very graceful way that many of us anticipated. Did public health experts, including yourself, at any point over the last 6 months advise the Indian government that we shouldn't be letting our guard down and that we should continue to remain vigilant for a second wave?
I've said that sufficiently often in the media. I've said that in both print as well as in television interviews. And therefore, this was very much in the public domain, even in January. Even in January, I'm on record as saying that at least till April, we should not let our guard down. So it is very much there in the public domain.
Yes. Ms. Muttreja, the question I wrote down to ask you was the fact that in India, we spend 1.25% of our GDP on healthcare. It's lower than most of our neighbors. It's abysmal in comparison to the rest of the world. But the question I'm actually going to ask you is this. Have you ever seen a public health crisis like what we're witnessing today? For me, it has been emotionally distressing to simply read through the cries for help that we receive on a daily basis, and then not be able to do anything because there simply aren't enough beds. There simply isn't enough oxygen. There aren't enough ventilators. So it doesn't matter how many people you call and who you try to reach out to. There's no way to help. Has India ever faced anything like this before?
No, India hasn't faced this kind of crisis, but to add to the existing crisis that we face often, but that has been incremental. Whether it is, if you look at the deaths because of TB, if you look at the deaths because of a whole range of other reasons, and not just deaths, morbidity, a high burden of morbidity. We have had silent pandemics going on, but something of this kind added to, a new burden, which actually has taken a lot of and much of the attention away from the existing pandemics that we have. So it has really stretched this very fragile health system that we had, which hasn't been able to deal with a lot of the killing diseases that we have. And at this point of time, what is really coming out is the abysmal investment, not just financial investment, but weak public health systems for management, lack of any preventive and promotive measures. And, people like Dr. Srinath Reddy, who moved from the AIMS is also public health in a way, moved away. There was a reason that a scientist, India's most eminent health scientist like Srinath, moves from AIMS to set up a public health institution. How has India taken advantage of that? We have neither invested financially nor in human resources, nor have we taken.
We seem to have a challenge with Ms. Muttreja's connection. We'll just get that fixed and get the audio also sorted out. But Dr. Reddy, a quick question that Aman Peshawari is asking, that the second wave is affecting children and expectant mothers. Will it have long-term health issues on them? So is it? Yes. Dr. Reddy?
Yeah. Well, basically, we know that children are being affected in larger numbers, and there are multiple reasons why. Firstly, the virus itself could be actually a little more virulent in that sense of targeting children. But I believe much of this is because in the last year, in the first wave, children were greatly sheltered at home. Schools were closed. They were not really going out and playing. There were a lot of restrictions on travel. Whereas after we felt that the pandemic had ended in early January, this whole society opened up. Even if the schools had not immediately opened up, there were exams around the corner. They were going for tuitions. They were meeting people. They were going to malls. They were going to theaters. In general, there was very little restriction on children meeting and mingling and playing. So I think there was a much greater level of exposure of children. But it's also true that we were also a very open society and even with adults traveling with families. There was a greater opportunity for viruses to come in. And if there are variants coming in, then there's a greater opportunity also for people to be infected by the variants themselves. And that could have actually caused problem. But it's actually going to cause later issues. We'll have to wait and see. So far, it appears from global experience that even if children are affected, the severity of the illness is not high, except in a very small percentage. The long-term effects in children are not really known. Like, for example, the long COVID, which affects about 1/3 of the adults with COVID, is not seen in children as yet. So we'll have to wait and watch. But pregnancy is an interesting question that you raised. One of the things that has been generally said is that pregnant women and lactating women should not get the vaccine because they're not included in the trials.
Yes.
And that's why immediately the manufacturers say, no, there's no way you're going to give them the vaccines. But now we have experience from people who have actually been vaccinated, if though not in the trials, in several countries in the United States and elsewhere, that it is quite safe. And actually the children seem to benefit from the antibodies that are passed from the mother. And more importantly, pregnant women are particularly more prone to the complications of COVID if they get COVID. So it's all the more necessary now to include pregnant and lactating women into the...
Will pregnant women who have tested positive of COVID, will their children, their unborn children, suffer any complication?
That we do not know yet. It does not appear to be likely that the virus crosses the placenta, but the antibodies do. So the mother being vaccinated actually protects the child. So it's absolutely important that we should be really protecting them as well.
Okay, Doctor, I do want to ask you this now from a public health point of view. Several newspaper reports now, I think, have made it very clear that there are state governments that are underplaying the death numbers of COVID. States like Gujarat, Uttar Pradesh, Madhya Pradesh, for example, the local press has reported that they're underplaying deaths greatly. In Gujarat, if the Hindu is to be believed, they're underplaying it 10x, the actual deaths are 10x what is being reported. Now, the question that I have here is this: from a public health point of view, if the government is not recording accurately, how then are we able to understand the nature of the crisis, to study the movements of the virus, to study, for example, demographic slices, comorbidities, primary causes, to say, for example, people with heart diseases are being affected more, they should be more careful. If we are mucking up the data to begin with, how can we plan our strategy to come out of it?
We do require data, and we certainly require accurate data and fairly real-time data if we have to plan our strategies and reframe our responses as we move along with the epidemic. As it evolves, our strategies must evolve too. And it's also true that, for example, unless you test a fair amount and also test a fraction of that for genomic analysis, you'll not know about the emergence of variants. So there are many things that we need to find out what exactly is going on wrong. I wrote in a recent piece in the print, my first line was, India's national bird is the peacock, not the ostrich. We need to find out the truth and not bury our head away from the facts. So we do need the facts, and it's only that kind of a valid real-time data that will actually guide us on the right path of decision making.
So is this current sort of hiding of data, I mean, we know that the government is now making a national plan that is going to submit to Supreme Court. Would it be possible to make an adequate national plan without the right data at all?
Well, actually, we know the rough contours of the pandemic. We know what needs to be done, what are the measures to be taken. We do know that. And the absence of real-time accurate data should not stop us from doing that. With data, with good data, we can do better. We can plan better, we can evaluate better. But roughly, we know what's to be done. We have to contain transmission, both at the level of the personal protection and at the level of the public policy and administration. At the level of personal protection, everybody must wear a mask outside and make sure that they're not mingling in crowds, and especially keeping away from crowds in indoor places. At the level of public policy, they must ensure that large gatherings, which are likely to become super spreader events, are absolutely prohibited. And that must be a resolute action undertaken, whatever the provocation, whether it's political, religious, social. You have to stick to that at least for the next 8 weeks, absolutely in a very strict manner. The third, of course, is to take good care of the people who are ill. Many of them can be treated at home. They don't have to rush to hospitals in panic like they're doing now. And that means you have to provide them some reasonable care at home. Guidelines first as to what to do at home if they're not very sick. Secondly, if possible, get primary healthcare teams and citizen volunteers to visit them regularly to find out how they're doing, maybe measure their oximetry, and provide them the confidence that if they need transfer to the hospital, the arrangements are worked out so that they don't have to run to pillar to post. So home care is an important element that has to be supported. Then, of course, the question of oxygen, hospitals, intensive care, emergency transport to hospitals, these must all be predictable. And of course, the last one is vaccination. Do step up the vaccination now that you've decided to have 18 plus age group involved. Plan it well, make sure that the people who are vulnerable, whether they're 45 or having other comorbidities, are not neglected in the process, that the poor are not marginalized because they're left to register for themselves with the states or private sector, that the poor and the migrants are particularly not marginalized. Make sure of these things, but make sure that the vaccination drive proceeds as per plan with speed and scale.
Well, looking at data, and I believe Ms. Muttreja is with us right now. She seems to have found a pair of headphones, which is nice. Looking at data of our inoculation drive, it's actually been falling steadily right now over the last 2 weeks, a 30% fall in the last 2 weeks of the number of people that we have been vaccinating, or the number of doses that we've been administering on a daily basis. It was 3.7 million, it's down to about 2.6 million. And only about 8.3% of our total population has received at least one dose so far. Ms. Muttreja, the plan the government has announced right now, which is basically that state governments will pay for the vaccination, that 50% will go to the central government, 50% will go to state governments and private hospitals and private organizations, which we understand Reliance is now chosen to vaccinate all of its employees. Do you see this as a good way to accelerate the plan, or is this going to cause confusion?
So it's not only going to cause confusion, but it is also going to, a lot of the poor people and the most marginalized people are not going to be able to afford the vaccination. They will not, most states are already starved of funds. And so they are not, even though some states like Bihar have announced they'll give free vaccination, but all the states are not, including Bihar. I don't know where they'll get the money to do it. And in any case, there is hesitancy. We know there's vaccine hesitancy in India. The numbers are going down, and the numbers weren't very high even earlier. We've had a huge amount of wastage too. But given that, you know, think of one family that is going to spend 1,200 rupees on 2 doses. If there are 6 members in the family, or even if there are 3 members in the family, 3,600 rupees, it's not going to be a priority. Second, people are scared to come to a facility right now. One of the reasons, amongst many other, the numbers are going down. People are going to be scared to go to facilities. Two, they're not going for essential services. Where will they go for vaccines? Third, I don't see, and we are not, in any case, I don't know how we are going to get the supply. Even if numbers come out, large number of young people might be more willing to come out, but where are the supplies? Why have we not, in a country like India, which supplies vaccines to the rest of the world, and we had 1 year to plan, why is it that we only have 2 companies producing the vaccine? I'm not even going to go into the Prime Minister gifting or sending away 60 million doses. What about some planning? We went into lockdown to plan for investing in our infrastructure. We had a health infrastructure. We had 1 year in between the last wave and the current wave to plan for the vaccination, even though I agree with Srinath that it was partly the surge was not, such a high surge was not anticipated for COVID to spread. But we anticipated we needed to vaccinate people. So why didn't we not only have more companies, more pharmaceutical companies in India, and we do have them, invest in producing vaccine, but also, the Serum Institute on many occasions, we've seen on TV, we've seen in interviews, they've been asking government to invest. Why did the government not invest? Where is the allocation that they mentioned in the budget? It was 330 crores. What's happening to that? I don't get it. Where is the PM? Why can't we invest the money that was raised in the PM Care Fund? Why are we not giving free to, okay, we can say that the Prime Minister is a great expert in asking us all to volunteer, whether it's Thali Bajao or give up our subsidies for vaccines. So he can ask the rich to give up, to pay for the vaccines. Why haven't we done that instead of wanting to charge the poor and the most marginalized? When in India have people come for preventive care or promotive care, even to health facilities? Look at our record even on immunization. The fact that people don't come, that immunization rates are so low, how are we expecting? Finally, I want people to come for vaccination. Finally, I want to just take 2 examples. Whether it's family planning or any other area, when the word spreads, there are side effects. Even if bad news travels fast, we all know that, right? So once people hear about side effects, and the government again is making the same mistakes as we've done in contraceptives, where we don't manage side effects, people are going from pillar to post, and there is no response to people who have side effects. Even if the side effects are not because of the vaccine, they're due to any other reason, the word gets around and the perception gets created that a vaccine can be risky business. So there are many areas to take care of. I believe it's going to be messy. And finally, I just want to say, you're going to have the same overworked health worker who was overworked even before the epidemic. Now you've added, you put the burden of dealing with the epidemic without without oxygen, without hospitals, without medication. And now you're putting the burden of vaccination also on them. So there are many areas which I find messy, not just the pricing.
Well, Ms. Muttreja, you mentioned the PM Cares Fund. Are you referring to the private trust that's not applicable to RTI requests? So unfortunately, none of us know where that money is because apparently it's private money now. So we can't even find out for you, unfortunately.
No, but we have to keep asking the question. We cannot give up. We have to keep asking the question. And finally, sorry.
We will keep asking the question, but I just want to bring in this angle, picking up from what you said and staying with the vaccine. Dr. Reddy, I remember you and I spoke and you said that the vaccine should not be available for sale in open market. Effectively, that's what we're looking at right now. If Reliance Industries can confidently say that they are going to procure and vaccinate all their employees and all their employees' family members, first, it sounds to me like the informal working class is simply going to be left out of this. It seems unfair. Secondly, it sounds like a bidding war is going to now begin, if not for the price which has already been declared, for the resources, because 50% of what is already short supply is now, I mean, you have Reliance Industries elbowing out state governments. How are we going to decide which state government will get this? The one that is closest, the one that is most desperate, the one that has most money, the one that is run by a certain political party? Who makes these decisions? And how can we have a private organization, a private limited company that is making a profit, make these decisions?
I entirely agree. Basically, vaccination, especially for an infectious disease, and particularly so in a pandemic situation, is a public good which needs to be provided through public financing. It should not necessarily strain the individual pocket. Agreed, some people may want the luxury of going to a private hospital to get it. Okay, we allowed that at a reasonable marginal cost. But now to make it open and entirely to a private market affair, where states will have to bid against private hospitals, about private companies, that is absolutely inequitable and actually defeats the purpose of public health. Now, as you rightly pointed out, it's only 10% of India's workforce that is in the organized sector. What happens to the remaining? What happens to the poor who can't afford it? What happens to the migrants? I'm particularly concerned about the migrants because they've already been battered sufficiently over time. Now, are they going to be given the vaccine by the state where they're working, or will they be told to go back to the state where they came from, where they're domiciled? How are they going to be treated in terms of the states also giving them the vaccine? And it is actually meaningless to take this kind of an attitude because infections don't look at your domiciliary certificate. They spread from person to person. So we have to make sure that everybody is vaccinated because it is in public interest to protect as many people as possible. And that's why it becomes the duty of the government, whether it is the center or the states. And we cannot pass it on to the private market forces.
Will this plan, Dr. Reddy, also lead to pilferage, where basically people within the public health system will start to steal the free vaccine to sell it to the people who want to pay money for it?
Well, I hope not. I'm afraid it might actually lead to a bit of pilferage. There was this honest thief in Haryana who stole a bag of vaccines thinking it was something else and then returned it with a note of apology. But it may not always happen that the people who intentionally steal it from the public hospital to sell it in the private market may actually get caught or have a change of conscience.
No, I want to address something, and I'm so glad that Ms. Muttreja is here because I've read this now in at least 4 or 5 different places, including in our chat window currently, where people are saying that our problem in India is the population. There are too many people here, which is why everything is difficult to manage. My personal response, and I say this with the deepest humility, is our population is our only resource in this country. These are working people who are earning and paying taxes. Every child, every adult who buys a packet of biscuits and a liter of milk pays tax on that, which goes to the government for a service we expect, a service in return for the money that we pay. State, center, urban, and rural. These are the governments that run the country. They're supposed to look after us. They're taking the money, but not looking after us. Population is not the problem. It's like saying there are too many people eating at my restaurant, and so I can't be expected to cook for everyone. You are charging them money. Shut the restaurant and give it to somebody else if you can't run it. Ms. Muttreja, do you want to address this issue of population being our biggest problem?
You know, in India, whether it is our politicians or people, we are so good at making excuses and sidetracking the issue. Always putting the blame on population, especially in this case, in many other cases, is to sidetrack the issue. Yes, there's a lot of myths and misconceptions about population issues, and Faye, you're somebody who really gets it. So it's always good to have you speak about this issue, even more than many of us. You're a great advocate for getting it right. But clearly, I believe that 99% of the people in India do not understand the population question. They do not understand that population is our asset. They also do not understand that we have not invested in helping people plan and have smaller families, even those who want. That there is a huge unmet need for family planning, which is actually it is similar to the problem that we are dealing with now in the COVID case. And we are going to deal with the vaccines, because all the family planning methods have side effects and we do not manage the side effects. In fact, population has a huge lesson for us as far as COVID is concerned. Secondly, I believe just like much of the mess we are in today is because we are seeing COVID has been managed by our political leadership as a political issue, less an issue of science and so on. Similarly, family planning has always been an issue we've never looked at with interpreting the data right. India has the best demographic data any country has. We've had it for many years, not just NFHS, but census, much before NFHS started 25 years ago. So I would like to say that we have made a mess of understanding the population issues, and our population also doesn't get it. I have respect for the people who are writing these comments or talking about this, because they have been misled by our political leadership, and not just this government, even before. You know, it has been successive governments not getting it right on family planning. In fact, the last UPA government messed it up totally for us during the emergency. So for now, it is a time, I think this epidemic is a pandemic, and the crisis we are in is a time to get it right, for us to be honest, for us to be guided by data and science and not politics, for us to remove the myths and conceptions around not just population issues, but what we are going to we already have a lot of myths and misconceptions about COVID. And it's going to be the same with vaccination. It is time we know what to do. There are enough people, there is enough analysis and expertise on learning. It's very important to learn lessons from what hasn't worked. And again, the vaccinations too, for family planning, not just all methods, have a big lesson for us. Why, if we don't get it, and if we don't learn from our mistakes, we are going to be blaming each other and the population, which is always the case. You ask any minister, when you speak to a health minister, education minister, anybody, they will always say, oh, we have a very large population and that's the problem. So people are hiding under the numbers and not using the numbers to create, to get the demographic dividend, for instance, we have. Instead, we are creating a demographic disaster by not investing in our young people, whether it is jobs or their health or their mental health. thank God for the first time, at least we are thinking of vaccination for the young people, and I really welcome that.
Dr. Reddy, we are now talking about the second phase that caught us by surprise. Is there going to be a third wave and a fourth wave that we should be planning for right now, along with dealing with what's happening at this point?
Well, we know these viruses are capable of mutation, and these variants can possibly cause fresh surges if they return. We are yet to understand which vaccines will be effective against current mutants as mutants, and how long the immunity conferred by the vaccination will last. We are hoping it will last certainly beyond a year, possibly to 2 years. And if we actually create a very difficult path for the virus to travel by creating people who are immune and also following precautions like avoiding large crowded events, then the virus may, for its own continuity, become much milder. It may become infectious, but not necessarily virulent. So we may see the change in the character of the virus as well. But nevertheless, it's difficult to forecast whether the change in the character of the virus will actually evade the effect of the vaccination, for example, over a year or two. But we should be ready for the virus to revisit us in case we are all vaccinated, or most of us are vaccinated or immune because of natural infection, and much of the world has also been exposed to the virus and has gained immunity. Then it is possible that the virus may actually become much milder. I wouldn't say it's exactly like a common cold virus, but possibly not as. But nevertheless, the lesson is whether we are expecting a third wave or a fourth wave, it may not be this virus. It could be some other virus. So unless you are preparing your health system to be strong enough during the steady state, you will never be able to have a swift and strong surge response in a public health emergency. So it doesn't mean that we shore up our health system only if we are worried about a third wave. We have to have a strong health system, whether it's a third wave from this virus or a first wave from another virus. We just can't take chances.
I also want to bring to your attention the numbers being reported in Bihar and Uttar Pradesh that have shown about a 200x jump in the last 40 days. Bihar, according to the Times of India, has seen a 20% jump in its mortality rate. Is there something, is it possible, and you did talk about the fact that we might have variants, is it possible that the virus is, mutating into different things in different states of our country and is perhaps going to behave differently?
Well, we know that there are at least 3 different variants which are having different regional patterns in the country. We know in Maharashtra, it is the so-called double mutant, which has borrowed features from a previous mutation in South Africa and Brazil, and combined it with a mutation that was seen for the first time in California. So that is the nature of the double mutant from Maharashtra. And then we know that in Punjab, Haryana, and Delhi, it is the British variant B117 that is the dominant pattern. And now from West Bengal, we are aware that it is a triple mutant that has just come in now, B168, which is an additional feature as well. And then Kerala has a different set of variants, but though not as ferocious as these 3. So we do have regional patterns, and it's possible that Bihar is getting more infected from what is being seen in Bengal, which could have additional features in terms of infectivity and possibly even of virulence. But we do not know. Unless we do more extensive genomic testing, we'll not know exactly how much is being contributed by the original virus and by the mutant. And unless we get our infection figures and the death counts right, as you rightly pointed out, we cannot correlate either the original virus or the mutant exactly with the proportion of deaths and cases being caused.
Also, Doctor, the Election Commission decided that campaigning will only involve 500 people at a time. We had the Prime Minister decide he's not going to go campaigning, but would instead address a video conference, which is good for him. But 500 people then got together in one place and heard him speak via video conference. Is the Election Commission completely missing the bus here on the decisions it's making?
Well, I wish the Election Commission had acted much faster and had prevented large-scale crowds from gathering. And I think the Calcutta High Court is now questioning their judgment. And I would like to see what the Election Commission has to offer by way of an explanation. I'd just like to say that the Honorable Prime Minister, when he was contesting in the 2014 elections, set in a very innovative method of having holographic projections in election meetings. And I thought that was very innovative at that point in time. So there is no reason why we need to have large crowds when the message can reach to people across anywhere, through their television sets and through a variety of other channels. So I think avoiding super spreader events at any cost is going to be one of the most important things, not just for the next 2 months, but I would say for the rest of the year.
Ms. Muttreja, my last question to you is about the institutions of our country that are meant to guard our rights, in this case, to equality and life. Whether it is the Election Commission, whether it is various institutions in charge at state governments and at central governments, has it been a collective failure across the board that has led us to this point where people are dying for want of oxygen?
I'd like to say, while there are many, many people to blame, but I would not include everybody in this. I would like to the political leadership definitely has failed us, but institutions like the religious institutions, Election Commission, the media, your Baradri, I think has failed us the most. While they do have, a Dr. Srinath Reddy, who says it all very politely, but they do not have, and they barely have him. Look at what they have, who they have speaking. They do not, there's no criticism of the government. So your community has totally failed us. Which is the best way to communicate with people. And those who have spoken up have been targeted. I mean, today it's a menace to even tweet. If you tweet the right thing or if you say anything right, it is seen as critical of the government. So, so what has really failed us is the lack of freedom to see the truth and be heard. So there are people speaking out. There are people writing, and if you see the international press, I think they're serving us better, but our government is not going to listen to them. So I would like to say collective failure. I won't include everybody. I will say that the political leadership and the media, along with bureaucracy, which does not seem to have guided their political leadership better. We've seen people in the health sector, in the government. These are not even necessarily public health experts. Even they are not speaking out. And obviously they're not being heard. We have enough evidence to know that what has failed us is not being the right information or the right strategies. And it's not just today, I'm afraid. It's been going on for a long time. Many of us, including Dr. Reddy, have, it's like a stuck up record when we say India needs to invest more in its public health money. Well, India needs to improve. There is an immunity maybe they have developed to us raising these issues. So it's not just during the pandemic. The seeds of a poor public health system were sowed long ago, or we didn't do anything about. But specifically in reference to the pandemic, the mess that we are in, yes, it's a collective responsibility, but not everybody. And some people have to take a much bigger blame. I'm afraid it's not just about the people who go to the election rally or that go to a Kumbh Mela, but it is those who are watching this and feel they can go anywhere, they can do anything. When a prime minister, the honorable prime minister, who is so respected in this country, is seen holding rallies and very proudly saying that he's never seen such a sea of people and big rallies. What is the message you're sending to the rest of the country? How will anybody, you can have behavior change communication, we can go back and say different things, but the people's perception, in people's perception, this is not a serious issue where you need to maintain physical distancing, wear masks. Our role models have failed us.
You know, while I the media, I go for the of among the media and I accept the fact that the media did in fact fail to do its job and did in fact fail to caution people, to question, to ask the right questions at the right time. Dr. Reddy, I don't trust. Yes, go ahead.
No, I said, to borrow a phraseology from the current pandemic, the political establishment and all its variants are responsible.
Political establishment and all of its variants. But I do want to ask you this, Dr. Reddy, the most important resource in healthcare are the people. The doctors, the nurses, the healthcare workers who have now been working for over a year non-stop in PPE kits that we understand is wearing them out and causing health issues for them as well. Another Indian summer stretches before us where we expect our doctors and nurses to continue working in PPE kits with an even more dangerous version of this virus. What impact, and we can continue, and governments are now building jumbo centers, but where will you get the doctors to put in those jumbo centers? What impact has this had on our healthcare workers, on our frontline workers, to see this stretch before us again?
They're exhausted, they're somewhat demoralized, but not defeated. They're still determined. And that speaks to their courage and their commitment. And I think they're fighting a very, very difficult battle at this time, but they're not giving it up. They're demoralized because they don't see the oxygen. They don't see the equipment. Without tools, how are they going to fight? That is their problem. And we do need to get to their aid as fast as possible, because if they're putting their very best, if we fail them by not giving them the equipment and the drugs and all the other supportive measures, then they will not be able to do what they wish to do, that is to save lives. And therefore, I think we need to ensure that this happens. But again, this goes back to building a very strong health system at the primary care level, at the district hospital level, and at the medical college level. Many of these admissions need not have taken place into the large hospitals into intensive care if they were detected early, cared for early in primary care, or even, let us say, who are the people who are dying most? People with hypertension, diabetes, coronary heart disease. These are things that should have been prevented or taken care of at primary care level. So you don't create comorbidities and then let the respiratory virus claim victims because you have not been able to prevent or treat comorbidities.
Right. I'm going to let the both of you go because we've really run out of time, but I want to thank you for being so generous with your time and for answering all of our questions. For our viewers, at 9 o'clock, the news bulletin is up. Remember, it's 10 minutes of just news. There's no opinion, there's no shouting, there's no drama. Also at 9 o'clock, we'll be talking to A. Velumani, who is the founder and the MD of Thyrocare, one of the testing companies. We'll talk about why there is a delay in test results. There have been reports of the fact that people can't get admitted unless they have a COVID positive report, but tests are taking 48 hours and sometimes in some cases 72 hours to get your report back. And we're going to try and find out from him what is going on and why test results are getting delayed and the other challenges that testing companies are facing right now on the ground. I thank both Dr. Reddy and Ms. Muttreja for joining us and for answering our questions today. Thank you for watching.
Thank you. Bye.